Hello everyone. Welcome to yourguardianstars platform. And welcome to my presentation. In this presentation, I'm going to discuss anxiety disorders and how we can manage clients with anxiety disorders. Okay, my name is Mulundano Maybe, and I'll be with you throughout this presentation. Okay, so in the introduction, first of all, I would like to let you know that this is a very long presentation. It's got about 100 slides, and therefore I'll skip certain slides that I know you will study on your own and be able to understand them. Down below the link of this video, I'm going to add a PowerPoint presentation that you have access to so that you may study these notes on your own. Alright, so anxiety is simply a signal to the body that aspects of its systems are under stress or out of equilibrium. Anxiety is actually a normal body reaction. It's a normal reaction to the anticipation of danger. Okay, and it's something that we may not do away with completely in our lives. It being a normal reaction, meaning for it to be put under psychiatric conditions, there must be certain habits or there must be certain types of anxiety that become disorders. Okay, because anxiety on its own, it's a normal response for our body. Okay, so there are those that we call anxiety disorders, meaning there are certain habits that we develop out of anxiety that are considered disorders. Okay, anxiety disorders are more common than any other class of psychiatric disorders, often not recognized and consequently not treated, resulting in chronicity. What this statement means is that if we were to pick all psychiatric conditions and put them in one basket, we would discover that half or 3/4 of those conditions are actually anxiety disorders. Okay, so they constitute a larger part of mental illnesses, but we usually give them a blind eye. We do not consider anxiety disorders as serious disorders. Therefore, they end up becoming chronic because we do not initiate treatment at an early age. Okay, so that's what this statement means. Also, anxiety disorders constitute the apprehensive anticipation of future danger or misfortune accompanied by a feeling of dysphoria or somatic symptoms of tension. Okay, and usually this triggers the fight or flight response. So what this means is that anxiety is usually as a result of anticipation of danger. Okay, anticipation of something bad to happen. Okay, so let me give you a scenario where we have an individual who is about to have their function. Let's say it's a marriage function, and then they become anxious. That person has become anxious because they are not certain of what is going to happen during that function. They might be worried about not meeting the expectations of the people who are going to be attending their function. So hence they become anxious about whatever might happen. So in short, anxiety is usually as a result of someone anticipating something bad to happen. Okay, so this is how compulsions are usually developed and anxiety disorders are developed. When someone is anticipating something bad to happen, they will develop certain habits or they will start taking certain actions trying to prevent that misfortune or bad thing or danger that they are suspecting or expecting to happen. So they put in certain interventions before that danger comes, and by so doing they will repeat those actions. They'll keep on repeating those actions until they become compulsions. So this is how compulsions are usually developed. So we are going to see actually on the types of anxiety disorders that compulsions is one of those anxiety disorders. Okay, so how can we define anxiety itself? So in the previous slide, I think we have given a definition of anxiety. This is one of my definitions that I have decided to give you. It's one of the simplest definitions of anxiety. So it's simply an emotional response to anticipation of danger, the source of which is largely unknown or unrecognized. Here it's about the source of the danger that one is anticipating. They usually develop anxiety because they anticipate danger and they do not know exactly what might cause that danger to happen. Okay, that's my definition for anxiety. So list 5 physical symptoms of anxiety. These questions are just put here to help you understand and also be able to revise. So there are not only physical symptoms of anxiety, there are also psychological symptoms. So here I've listed both physical and psychological symptoms. For psychological symptoms, we have psychological symptoms. Someone might present with fearful anticipation, and they might become very sensitive to noise, and they might be restless, and they have poor concentration and anxious cognitions. Okay, so this patient, this client is going to be to have that fearful anticipation, of course, and they will be very sensitive to noise. Just by hearing any slight noise, they'll be tending to check the source of that noise, that it could be the source of the danger that they are anticipating. Okay, so this person usually becomes very sensitive to any sound around them. And for physical disorders, of course, all physical disorders are listed according to the body systems. Okay, we have the GIT, which is the gastrointestinal tract, the respiratory system, RS, cardiovascular system, the CVS, the genitourinary tract, the gut, and the MSS, the musculoskeletal system. So those who have been anxious before, you can testify with me that most of these signs that I have listed under each of these systems, we actually experience them when we are anxious about something. Under the GIT, the gastrointestinal tract, one might have a dry mouth, and they may develop swallowing problems, difficulties with swallowing, of course, and they may have frequency of motions. Frequency of motions may result in the patient developing diarrhea, okay, under the GIT. The respiratory system, difficulties in breathing, hyperventilation, pins and needles in extremities and mouth. Okay, so this person will feel like there are certain pins that are being pushed in their palms, okay, needles, and also in their mouth when they are anxious, and they will usually hyperventilate, and they may have difficulties with breathing. Under the cardiovascular system or the CVS, this patient is going to have a rapid heart rate. They'll have palpitations and chest discomfort, and they'll be aware of their heartbeat. They'll be feeling their heart beating against their own chest. Okay. Under the GUT, the gut, this patient may have frequency of micturition and sexual problems and menstrual problems. Usually, for women, when they are anxious, they usually bleed before their time comes. And sometimes people will develop sexual problems. They will lose interest in sexual intercourse. And sometimes the person will have loose sphincters, of course, and they may end up passing urine involuntarily. Okay, that's frequency of micturition. Or someone will actually be frequently going to the toilet time after time. Okay, and for the MSS, the person might begin to tremble, that's the tremors, and also they may have headache and also some aching muscles. They'll be feeling body pains that have no root cause, of course. And sometimes an anxious person will have sleep disturbances like insomnia and night terrors. These are whole nightmares. The person may be having nightmares because they are worried about something, or they are anticipating something bad to happen. Mention 3 causes of anxiety. So I have classified or listed these causes of anxiety in 2 forms. So we are going to see exactly what these causes are. Okay, so for the etiology of anxiety-related conditions, we have both mental and physical factors that are usually involved. So we have environmental stressors, of which a person might be exposed to a life-threatening disaster, or the ending of a significant relationship, or just witnessing or being involved in an accident. That's a life-threatening disaster or a life-threatening situation. Also, such may predispose someone to developing an anxiety disorder. Okay. Also, for patients who are suffering from any psychiatric disorders such as those listed below, depression, anxiety disorders themselves, and eating disorders and avoidant personality disorders. So for patients who have any of these psychiatric disorders, they may also be at risk of suffering from anxiety disorders. We are going to look at the types of anxiety disorders, what those that we are talking about exactly in the presentation. All right. So, and some physical factors include hyperthyroidism. These are conditions that usually affect the body systems. Okay, so when those body systems are affected or they are stressed out, they present with symptoms of anxiety. Okay, remember in our definition and in our introduction, these systems must function harmoniously. But if there is any form of stress in these body systems, one may present with signs and symptoms of anxiety. So these are the physical disorders that may directly cause an anxiety disorder in a patient. So these conditions include hyperthyroidism, hyperadenocorticism, heart failure and arrhythmias, and also asthma. Okay, for heart failure and arrhythmias, these usually affect the cardiovascular system. Hyperthyroidism, this is due to an increased level of thyroid hormones, and hyperadenocorticism also is also as a result of increased levels of adrenal hormones, and this will usually present with anxiety symptoms. We also have drugs. For patients who are taking any of such drugs, they may also present with signs of anxiety. Drugs such as bronchodilators, psychostimulants. Psychostimulants could be dangerous drugs like marijuana. Okay, those may be put under psychostimulants. Those may also trigger anxiety in a patient. And the effects of corticosteroids, even caffeine, can also produce signs of anxiety. For patients who were taking alcohol and they are trying to withdraw from alcohol, they may also develop anxiety disorders. Okay, or they may also present with signs of anxiety. The etiological factors also can be classified into these three groups. All those causes or etiologies of anxiety can be classified into these three groups. They can be biopsychosocial causes or simply biological causes, or they can be psychological causes, or they can be social related causes. So let's look at these in details. For psychological causes, these are usually related to early childhood experiences. For social related factors, these usually related to the interaction with other people and one's environment, okay, in the society where you are. So for biological factors, we have two factors under biological factors. Okay, we have the genetic factors and also biochemical factors. Under genetics, it's believed that anxiety is usually inherited from parents. Alright, so if you have parents who are suffering from any of the anxiety disorders, you as a child are also at high risk of suffering from the same condition, because it's usually genetic, it runs through families. Okay, biochemical, this is something to do with imbalance of serotonin and gamma aminobutyric acid, which is GABA, and these are simply neurotransmitters which regulate your emotions. If you have any imbalance, if you have any conditions or anything that is disturbing the levels of serotonin in your brain and also GABA, you might be at risk of suffering from anxiety disorders. Okay, these are simply neurotransmitters that regulate your emotions. For sociological factors, how can sociological factors be predisposing factors to anxiety disorders? So sociological factors, it's to do with you having the available or having the necessary support system. Support system could be availability of money, it could be availability of friends who can stand by your side emotionally, physically, when you need them, or when you are faced with danger. Okay, so having things available to help you cope with the stress that you have may prevent you from having any anxiety disorders. But if you do not have the necessary support system around you, you may end up developing anxiety because you do not know who is going to stand by your side and help you out when something bad happens. Okay, so you having someone by your side to stand by you and fight with you, that may take away that fear in you, and you may not be stressed, and you may actually find some comfort in that, and you may be prevented, or you may not develop the anxiety that we are talking about here. Okay, so under sociological factors, it's about having the necessary support system. If you do not have the necessary support system around you, you may end up having anxiety or developing an anxiety disorder. All right, so I mentioned 4 types of anxiety. We are going to look at types of anxiety disorders. Okay, so for types of anxiety disorders, we have an endless list of anxiety disorders, and I've just listed a few anxiety disorders that I thought were very important for you as a student nurse. But of course, the list goes beyond what is on this slide. Okay, so we have the types I've listed here are the generalized anxiety disorder, which is also called GAD. We have panic disorder and phobia. Phobia, we're going to talk about social phobia and social anxiety disorders. So we have a lot of phobias as well, and I think I'm going to mention some more when we discuss what phobia is. And also we're also going to look at obsessive compulsive disorders and somatoform disorders such as hypochondrosis. Then we'll also look at post-traumatic stress disorder and acute stress disorders. Okay, so these are a few anxiety disorders that we are going to discuss in details in the next presentations. So please, I want you to please make a date and watch our next presentations on how we can manage these types of anxiety disorders. Thank you so much, and see you in the next presentation.